Now, Fox 6 Family Health with Devin Walsh.
Do you develop fear and anxiety when you even think about going to the dentist? Well, did you know there's a technique where you can go to the dentist, have a procedure done, and not remember a thing? A Pelham dentist says it's reducing the fear of sitting in the chair. It's hard to miss the big yellow sign outside Dr. Keith Dillard's office on Highway 261 in Pelham. People are flocking to his office for what's called sedation dentistry.
They can get their dental work done, and most of the time they're going to not really care or know much about what's going on while they're having it done.
Patient THELMA Horton is undergoing sedation dentistry, or conscious sedation, while Dr. Dillard replaces 6 of her crowns with veneers. Conscious sedation means that the patient takes a sedative, like Valium, before the procedure begins. It makes them really sleepy, but it doesn't put them to sleep.
Them on a scale of 1 to 10, if 1 is asleep and 10 is wide awake, how do you feel?
About 7.
Dr. Dillard says this isn't used for any dental procedure. He doesn't use it for minor procedures. He says the patient has to have very high anxiety.
We're having people come in our office that just sit down in the chair, begin to shake, and sometimes my hygienists just come in to talk to them, they begin to cry. And so there's people that really have a much more significant phobia about all types of things that are done in the dental office.
While Dr. Dillard works on Miss Horton, she isn't aware of anything going on. We caught up with her a few days after her procedure.
It's amazing to go in and have 5 hours of dental work and then to not even remember it.
She only remembers being seated in the dentist chair, and that's it. She doesn't even remember our camera being there. All she knows is she has new veneers and that it was an easy experience. You can see the difference in her before and after pictures.
There was no pain. I slept that afternoon. I slept all night that night, and then I slept the next day, you know, on and off. But really, there was no pain.
Sounds like that's the way to go. Well, Dr. Dillard's staff does a medical workup prior to giving the patient the medication Valium. They want to make sure the patient is healthy and that Valium won't interact with any of their other medications.